my patients and a lot of my audience online are always asking me about post-op, post-procedure pain. What was your history like the very next day? How much pain did you have? How much discomfort? What were you able to do? What limitations did you have right afterwards?
Right afterwards, I would say zero pain on the way home. I was just very sleepy.
Showering?
I could shower. I was just a little more careful washing, but showering was fine.
Driving?
Driving was fine. No pain.
Excellent. And just light activity like walking?
I was back to walking within, I say, 3 to 4 days, and I babied myself just because I'm a baby about that, and fully back to my 5 days a week Pilates schedule within 2 weeks.
Perfect. Excellent. And right now, what's your pain level?
Zero.
About a month out? Most of my patients usually say, when I see them for their follow-up, and it's only been like 6, 7 days, they say that when they're sitting or standing or walking, they've got no issues at all.
Yeah, none.
It's only if somebody touches them,
Yes.
or the transition from
Yes.
sitting where it's a little
Getting
sore.
in and out of the car was a little sore here.
Right.
If someone pokes you, it's sore, obviously.
Right.
But other than that, no pain.
Perfect. And then once the anesthesia was in place, with the actual UltraSculpt lipo procedure and the quantum.
Zero pain.
Okay. Wonderful.
Like a gentle, warm vibration. That's what it feels like.
Perfect. As far as any advice you might give to a friend, a family member who's interested in possibly doing this, they're on the fence, they're sort of debating, what would you say to them?
To make sure and do your research. Liposuction has come leaps and bounds from what it was previously. You don't need a lot of downtime for recovery or pain to get the results that you want. Make sure you do your research. I'm always gonna suggest Dr.Setari. I have 3 girlfriends coming in to see him. If you wanna look natural and fresh, minimal downtime, this is your man.
God bless you. Thank you, dear. So I'm delighted that my patient got such fantastic results, and she's so happy and had such a wonderful, painless recovery. But let's go step by step and see what it is that she was addressing with each area and how we address those areas. So your abs look absolutely fabulous. They're flat as a board. The skin is super tight. What were your original concerns that you wanted me to address when you said, hey, can you take care of my abs?
Okay, so I still had really a flat stomach. I self-diagnosed, think I have early stages of lipidemia, which were showing heavily in my lower body, which is something that Dr. Setari took care of for me. But in the upper part of the abs, I started to have some rippling here. And I was doing my lymphatic drainage and work out 5 days a week, eat healthy. This was just not gonna go anywhere. So he suggested we just go in there with the laser, do a little melting and tightening.
The Quantum RF.
The Quantum RF laser.
Right. The laser's great, but Quantum RF is
RF laser
far superior, yeah.
And as you can see, I don't have, again, my tummy looks like it did before, just without the rippling here.
So we went through the belly button. You can't even see the scar. It was a little tiny needle hole. We went through the belly button and we did the Quantum RF all up and down and to the side of her upper abs here. That melted what little bit of fat she had here, but most important of all, it caused a 3D contraction. This way, and internally, which is what gave her, is now giving her this wonderfully smooth look with really no rippling at all. You just barely maybe can see a remnant of it here, but remember now, she's not done healing. She's only a month out, but this was like everywhere. And now the rest of it's looking beautiful and smooth. And in the lower abs, what concerned you?
Same sort of thing. I had just a tiny little pooch right here. I wouldn't even say like the full fupa, just very minimal. But it was taking me a pant size up. And again, diet, exercise, there's only so much you can do. I'm 45, I'll be 46 in about 3 weeks. And I just wanted him to do something minimally invasive that wasn't going to kill me, that kind of would jumpstart me seeing a result from all the exercise and diet. And again, right above my C-section scar, no pain, no rippling, which was my big thing, is not getting more rippling of the skin.
Right. Now here what we did, because you did have more fat than the upper abs, just melting it wouldn't have been enough. So I did a little bit of minimal lipo with my UltraSculpt procedure here under local anesthesia, reduced the fat, and then went in with the Quantum RF and just polished the whole thing off. Cauterized everything and tightened up that skin. And again, I mean, we can see, look at how tight that nothing's hanging. There's just nothing hanging there at all, which is great.
Yeah. the back.
Going back to your thighs, if you notice now, it's really pretty much all smooth.
Yeah.
No more rippling, no more dimpling, and absolutely taut skin. Again, we didn't do any lipo. I actually don't like doing lipo on the anterior thigh unless it's really necessary for the patient. But just with the quantum that we did, we melted a little bit of fat, and most important of all is that we just tightened everything up and snatched up the look, you know, with such beautiful legs. What was the emotional toll?
I mean, it's just awful because my husband's like, how come you don't, I buy you all these things and you won't wear them? And I'm like, I don't like shorts. It's just not the body feature that I want to accentuate. It's not my best asset. So now I feel like, I mean, we had a pool party the other day and it was like walking around in bikini. I haven't done that since my early 20s. Like I have not done that since my early 20s.
Honestly though, at 45, this is a body a 20-year-old would envy. I mean, that is a gorgeous, gorgeous body. What about this?
My biggest improvement for me was the side. I think is this the banana roll or is this?
Well, this is the banana roll. This is the outer thighs.
So the outer thigh, I kind of had just genetically a big pocket of fat that was here always.
The saddlebag
the
kind of.
saddlebags. Yeah. I've been 109 my whole life, had them. They didn't go anywhere. I'm at like 120 now. They weren't going to go anywhere. So really just this area, having him, we did lipo,
yes, UltraSculpt.
UltraSculpt here,
yep.
Night and day after.
And if you go ahead and face forward for me. I mean, there's nothing. There is no more saddlebag here, but look at the natural contour of your outer thigh. Because you don't want to be flat.
No.
You know?
No.
So
you can see this one still has a little bit more. It's healing a little bit more than this side.
That's where the 4 to 6 month comes in.
Yes.
You know, if you squeeze and you're like, oh, that's still a little tender, that means it's still going to heal.
Yeah.
There's still inflammation in there.
Yeah.
I went in here because you had a lot of divots in through here. You barely have anything left now. We did one pass and it really just smoothed everything out on both glutes and gave you a little bit of a lift too with the skin. So what were some of the improvements that you saw in the gluteal region?
So right off, this was really my problem area before. So the eye focus would always go here. So now you can kind of really see the upper glute shelf and the bottom. So just more definition and push the butt up.
Beautiful, beautiful. I'm so happy for you, my dear.
Me too.
I'm so happy for you.